Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Dr. Kevin Michaels. He's the health officer here at MCHD. Dr. Michaels, thank you for being on Wellness Wednesday.
Well, thank you.
Now we're going to talk about this program called FAB. So
Yes.
can you tell viewers a little bit about it?
Yeah. Well, I've elected or decided for Mobile County Health Department to participate in the Public Health Accreditation Board process called FAB. All right. This process involves documenting our story of why we do the things we do as a health department. We refer to our legacy of excellence since 1816, and we need to show our procedures and our policies as an organization. This is very similar to what we do for Joint Commission accreditation process. And with one exception, we'll be focusing on public health, population-based care, and it's not necessarily on the individual patient care. Don't get me wrong, patient care is important. However, public health should be focusing on everybody in our community. And so we've gone through this process to set us up for this accreditation process. And we've appointed Destiny Lancaster over in data management, and as well as many others to help us through this accreditation process. Destiny is asking the hard questions of staff leads. Why? And show me where the documentation lies, why we do what we do. So
It sounds like there's lots of pieces and parts there with the accreditation. And it's probably going to take us some while to get it completed. So when does the survey start? And what
well, I,
what's it going
and
to?
yeah, another part of this process is a workforce development plan. We don't have one. We have many plans and policies, but we don't have a workforce development plan for our organization. And so in the part of this whole process, we've appointed Nobles. Kelvin Nobles has been designated our champion on the workforce development plan. And we're going to begin developing a plan with a needs assessment. And we have partnered with De Beaumont to execute this needs assessment. De Beaumont his mission is to advance policy, build partnerships, and strengthen public health organizations across the country. And in the coming days, you will see information regarding what we're calling, or what's been called, a PH Wins survey, Public Health Wins survey. This will be our start of our needs assessment. This survey will ask questions on key workplace topics such as workplace culture, morale, satisfaction, and training needs, as well as other demographic characteristics.
Well, there's a lot of data, I guess, that's being collected. So once we get all the results back, what are we gonna do with it?
Well, yes, we've asked similar questions in our organization, from Service for Excellence. But this will allow us to compare with other similar organizations and have access to our shared experiences so we can compare like to like, other health departments same size. Previous surveys have been assessed nationally through De Beaumont in 2014, 17, and 2021. And results can be seen on the PH Wins website. The survey results identified stress, burnout, and PTSD are big concerns for the workforce following COVID-19 pandemic. So the PF Wins will assess the perspectives and skills of all employees within our organization, and findings will support investment in workforce development, workforce improvement in our department and nationally. The results of the survey will be used to inform and guide our workforce research, development, and training for developing our workforce plan.
Wow, that's a lot of stuff there.
Yeah.
People are always asking about anonymity and privacy when they take surveys. So
That is a great point. I'm concerned about that too. Hey, when I put my information, are they going to know who I am?
Mhm.
Well, yeah, as a health officer, they're probably going to figure it out. But that anonymity or privacy, the big concern, is important. And let me start off by saying the participation in the survey is voluntary. All responses to the survey will be kept confidential. Identifiable information, such as your name and email address, will be separated from your responses to further protect your privacy. And only the De Beaumont research team will have access to this information. And the De Beaumont Foundation takes anonymity very seriously and will ensure respondent privacy is protected. MCHD, your leadership, your supervisors will not have access to individual level data. That's one thing that comes out from this organization. And they've done numerous surveys nationally across our country. So they take it seriously. And I just want to assure you, I'm interested in what we have to say. I'm not interested in who is saying it.
Well, that would
So,
certainly give a lot of people peace of mind to know that. So that's good. All of that stuff is secure. It's all handled off sites, third party. So that's good to know. So when you get all of the results back and that's all tabulated and calculated and everything, what's the implementation as far as rolling it out? I guess
the survey is going to start. You're going to see some email messages from me, from the organization, reminding folks that the survey is going to come out 9 September, and we've done a lot of coordination. We have the role of everybody in the organization. We have their work email address, and so that when the foundation sends the survey, it's going to get through our firewalls. And so you're going to get an invitation to participate with the survey, regardless of your job or your function. The link you will receive will be unique to you. So the big thing about it is don't share your link with somebody else. All right. The link is tied to you. Do not delegate it to somebody else to do. We do, and really we value your perspective. So that's how it's going to be rolled out. We'll get the data back and as they go through the analysis, because we are one of our organization is one of many organizations nationally that are participating in this process. And like I said, they have done this survey multiple years, and so they're going to compare like organizations and share, and what we should benefit from that is the experiences they have gone through and potential solutions to help us guide in developing our workforce plan. So I kind of want to finish up. Your participation in this Public Health Wins survey is invaluable. And I want to thank you in advance for taking the time to respond. So it's going to start 9 September. We will probably have 30 days to remind people. So if you get tired of my email messages coming out asking you to participate, we want the input from the organization. We have roughly 480 people in the organization, give or take, and everybody has a unique perspective, unique skills. And we want to include all that in to kind of show who we are, how we compare to others, and look at best practices, evidence-based practices to help us guide what we need to do to further better ourselves as an organization. So again, thank you.
And the FAB, that's PHAB. So
yes, the Public Health Accreditation Board process.
Yeah. So when those emails start coming in, people won't be surprised where it's coming from.
I hope they're not surprised, but you never can tell.
Well, Dr. Michaels, thank you for explaining the process and what we'll be doing for the next few months and the survey, and also giving peace of mind too about the anonymity and the privacy as well.
Yes, thank you.
Thank you.